In our last video, we defined what endometriosis is, and we said that endometriosis is when tissue that is meant to line the uterus, endometrial tissue, when that tissue grows outside of the uterus. Now, typically, when this tissue thickens inside the lining of the uterus, if a pregnancy does not occur, that tissue is then shed through the cervix. However, if you have endometriosis and that endometrial tissue that's meant to line the lining of the uterus grows outside the uterus, that can cause pain, inflammation, and scarring, and it can cause adhesions. What happens is that tissues that are meant to slide and glide get stuck together, and that can cause pain, inflammation, scarring, and dysfunction. What symptoms may you be experiencing if you do think you may have endometriosis? You may have very painful periods, very heavy periods. You may have pelvic pain or pain with intercourse. You may have bladder pain, pain with urination. You may have pain in the rectal area, pain with bowel movements before or after a bowel movement. In some less frequent cases, you may even have chest cavity pain or rib pain, because remember we said that the endometrial tissue can even grow in the abdominal cavity or the chest cavity. A lot of women feel bloated, distended, swollen, and just very uncomfortable in that area. So if you have these clusters of symptoms and you feel like you should go to a healthcare provider to ascertain whether you may have endometriosis or not, it's very important to understand that the healthcare provider should take a very comprehensive history of your symptoms, what you're experiencing, a family history, because there can be a genetic component to it. However, there is no other good diagnostic test like a blood test to identify endometrial tissue other than a surgical procedure called an excision, which they excise a little bit of the endometrial tissue and then identify whether that's endometrial tissue or not. So have no fear, there is great holistic options for the treatment of endometriosis. We will discuss that in the next video. So if you haven't subscribed already, please go ahead and hit that subscribe button so you don't miss any other amazing videos.